Hello, I'm John Foster, and I'm a medical doctor who does Social Security disability exams. Today is going to be the first in several videos about the signs of functional illness in the physical exam. As usual, everything I say is based on my own study and experience and does not reflect the official position of the Social Security Administration or any other medical body. By functional, I mean signs of physical illness that are created by the patient's mind rather than by any physical disease or injury process. There are many different reasons for functional illness, and I won't be getting into them in this video. They can range from psychosis to malingering. The first sign I have found presents itself before the patient even gets on the exam table, and that is the patient who's festooned with medical appurtenances. I mean the patient who tries to create the picture of illness by applying various splints, braces, and wraps all over their body. I have a rule, and again, this is only based on my experience. A patient who presents with one splint probably needs it. A patient who presents with two, maybe. With three, probably not, although I suppose it's possible. With four or more splints, bandages, or wraps, every single patient I've seen had a functional problem. I'm sure somewhere out there in our population of 7.5 billion people, there's someone who needs four or more medical appurtenances, but I have yet to meet that person. When a patient presents with splints, bandages, or wraps, I always ask them to remove all of their medical appurtenances before I begin the examination. And during the exam, I try to determine if those things are necessary or are for display purposes. I begin the physical exam by looking at the patient's head, eyes, ears, nose, and throat. And here's where the first common sign of functional illness pops up, and that's histrionic eyelid movements, either batting the eyes, or squinting, or both. Now, I have to say there are many physical conditions where the patient may have to blink frequently and or squint. But in the functional patient, I see these while my attention is drawn to their eyes, while I'm examining their extraocular movements and pupillary light responses. But they only blink normally when the attention is devoted to other body parts, such as joint examinations. After I've examined the head, eyes, ears, nose, and throat, I do a screening range of motion exam. I've posted a video on my screening range of motion exam earlier. For some reason, functional patients tend to present with abnormal ranges of motion of the cervical and lumbar spine and shoulders, but rarely with other joints. I have no reason why that is. All I know is that's what I see in practice. First, for the cervical spine range of motion, I ask the patient to move their head around in as big a circle as possible, like so. I note two abnormal movements in physical disease. The first is when the patient has a painful neck, and that presents like this. The patient will initially move normally, and then they'll reach a point where it hurts. They'll move guardedly and limitedly, and then they'll go back to a normal range of motion. The second is when the cervical spine is stiff and has a limited range of motion. And I see this most often in patients who've had cervical fusions. These patients will move their head around in a smooth circle, but the radius will be smaller than a patient who has no cervical spine limitation of range of motion. Functional patients move their head around in what I call a bobbing and weaving motion. This is similar to the head movement that a boxer utilizes to prevent their opponent from being able to punch them in the head. They'll sort of dart in different directions instead of moving their head around in a circle. I've seen this countless times. I have no idea why people think that that's the way people with serious neck problems would move their head, but it's always been a sign of functional illness in my experience. After I've assessed the cervical range of motion, I have the patient abduct their shoulders, raising their hands up over their head. And here is where I see two signs of functional illness. Again, a patient who has a shoulder problem, for example, pain at 90 degrees, will move their arm up at a fairly normal rate and then stop or slow down considerably. Functional patients do what I call moving in slow motion. Every motion you ask them to make is very slow, although they may move their joints through a full range of motion. The second is what I call the poor me posture. This is a posture of the arms that functional patients will display often when I ask them to abduct their shoulders, that is not duplicated in any physical illness or injury known to me. I'm going to have to back up to show that. Here is the poor me posture. It's like an M. The shoulders are abducted almost 90 degrees, the elbows partially flexed, and the wrists loose and partially flexed. The final thing I'm looking for in range of motion testing is discrepancies. By that, I mean a patient displaying a limited range of motion when the exam is focused on that extremity or joint, but having a much greater range of motion when attention is not focused on their joint. I gave an example of this in an earlier video. A patient didn't know I was observing him in the parking lot and raised his arms high over his head 3 times without any difficulty whatever. Then, during the range of motion screening, I asked him to abduct his shoulders, and he complained that he couldn't lift his arms up any higher than this because of severe pain in both shoulders. That's the only situation in which I think that you can diagnose functional illness based on one sign alone. One thing that makes me curious is why don't functional patients study their disease and learn the symptoms and signs? They'd be much better off at convincing me they were actually ill or injured. I suppose there probably are some patients who've gone to YouTube and Wikipedia and found all the symptoms and signs of their disease and have completely pulled the wool over my eyes. But so many patients present with incredible histories or bizarre physical exams. I actually asked my mother about it some time ago, and she told me it's simple. These people don't want to work, and researching a medical condition is work, so they don't do it. As an aside, everyone who does my cervical range of motion test comments that their neck pops and crackles when they move their head around in a circle, as if this is something extraordinary and unique to them. It's normal. Every adult's neck pops and crackles when they move their head around in a circle, and it does not indicate cervical spine pathology. There are even a plethora of websites which teach patients how to convince doctors by history and physical exam that you are disabled. Many of them seem to be intended for people who are applying for Veterans Administration disability. That's all I'm going to talk about today. Remember, excessive use of splints, bandages, and braces, eyelid batting or squinting, moving in slow motion, bizarre neck movements in range of motion testing, the poor me posture in shoulder range of motion testing, and discrepancies in the examination of range of motion of any joint. And always remember, if it happens, it's possible. In my next video, I'll go further into the physical exam and more signs of functional illness.